Researchers have found another link between social media and depression in teenagers. Hello, I'm Michael Prince with BecauseFamily.org and FamilyTechBlog.com. Researchers in Montreal have done a study of nearly 4,000 students over a period of 4 years, and in this study, they have worked to try to sort out what types of screen time are more of a determining factor for depressive symptoms in teenagers. They tested 4 types of screen time: social media, television, video games, and general use of a computer. Interestingly, the study found an increase in depressive symptoms for every hour a young person spent on social media. They also found a substantial increase in depressive symptoms with kids who were just generally using computers as well as watching television. The theories behind why these had such an impact are their relation to other people and how, as you use social media, you're connecting to others versus a video game, which actually scored pretty low on the depressive symptoms scale, in which you're engaging with non-real people on a screen. In the study, it highlights the fact that adolescents who spend a lot of time on social media spend more time comparing themselves to others. They say that this is likely one of the major contributing factors to depression in young people. Watching other people on TV and using social media on your computer can also increase the amount of time you spend comparing yourselves to the lives of others. Finally, this study concluded that all of these forms of screen time should be taken into account when trying to prevent depression in young people. They also said that we need to advise parents to limit this amount of time that they spend on social media, because after all, parents are the first line of defense when it comes to your kids' mental health. There has been tons of research done trying to connect social media or tech use in general with depression and other mental illnesses. What's interesting about this study is that they broke down the types of social media in order to give us a better understanding of not just time in front of a screen and how it affects us, but what we're doing on those screens. A few things stood out to me as I looked over this study. One of the things is that video gaming didn't really make the list as to one of the types of screen time that can put you at higher risk for depressive symptoms. As I mentioned, I also found it interesting that they separated the types of screen time in this study. I really hope that this is something that future researchers start doing, because it is really one of the best ways to isolate and identify some of the things we can do, whether you're a mental health professional, a counselor, a teacher, or a parent, to help our kids have stronger mental health outcomes and feel better about themselves. If we're pulling them away from video games constantly because of their constant outrage, but they're feeling angered because of the time they spend comparing themselves with other people on social media, then this data can really help us make a better, more specific choice towards what our kids need to help them be healthier. Finally, this study seems to be calling on doctors, psychologists, and counselors to look at screen time limits, or screen time fasts even, as a real treatment for some of these issues, and especially for prevention. Many studies have proven that social media is a determining factor for your kids' mental health. Who are they communicating with? Who do they talk to in their private messages versus who they see on their public stories? This kind of information is very important, especially since sometimes our kids aren't going to know who to come to when they start to have some of these mental health symptoms and issues. If our kids are going to other kids for help, that's the blind leading the blind. Oftentimes they're getting bad advice, or they're getting encouraged to continue deeper into the mental health issues that they're already struggling with. Our kids need to seek out a helpful adult, whether it be a parent, a counselor, a psychologist, a teacher, a coach, a pastor, somebody who can listen to them in a safe space, understand that what they're dealing with is real, and the feelings and emotions are valid, and that they need to have the right kind of help to help them sort this out and become healthy again mentally. Vague posting on social media, talking with your friends on social media about how you feel all the time isn't as helpful as seeking out a professional. And parents, if we haven't created this safe space for them to come to talk to us, then we're failing our children. Our kids need to know that they can come to us with issues even as serious, especially as serious as their mental health, and that we can be there for them to help them get the right kind of help that they need. Thank you for watching. I'm Michael Prince with BecauseFamily.org and FamilyTechBlog.com. Please visit BecauseFamily.org/partnership to learn how you can support Because Family as we try to reach out to as many parents as possible and bridge the technology gap between them and their kids, thus protecting children and teenagers from adult content, sexting, cyberbullies, predators, and all the other things that can be a danger to them online. Thank you again. We'll see you next time.